Hi, good evening. My name is Dr. Laura Diaz, and for my obsessive compulsive and related disorders treatment group, I will be going over obsessive compulsive disorder. So, my client's name is Antonia Watson. She is 38 years old, and her primary and only diagnostic feature is for obsessive compulsive disorder. A little background on my client: she's a college professor and she worries a lot about work. She'll grade assignments and regrade them again. She does have a TA, but she feels like she needs to recheck her work as well, just to make sure it's right. She does have a history of doing this in the past when she was a student. So when she would do her homework, she would recheck it, and it's now affecting her work and her home life. So during the past 3 years, she will spend 2 to 3 hours a day engaging in behaviors and her own behaviors, such as she'll spend at least an hour going back and forth between her curling iron, the coffee maker, and the front door, just to make sure everything's safe and okay. Once she does make it out the door, she will get in her car and she will go in circles around the block just to make sure she didn't run anyone over. She does admit that her fears are unrealistic, but it's impossible for her not to engage because it makes her excessively anxious and scared. She is unable to control the obsessions and the compulsions. She also admits that she's scared for her daughter. She's purchased a cell phone. Her daughter is 6 years old, and she worries because she goes to school all year round. She has a babysitter, but she'll text every hour, and that means the babysitter has to play an active role in this. So if they don't respond within that hour, she'll call and call until she can get a hold of them. She also practices ritual praying. So for her primary and only diagnostic feature, she shows that she has obsessive thoughts and compulsive behaviors which are distressing to her as a person. She has an inability to control the obsessions and the compulsions. So for Axis 1, the diagnostic feature is obsessive compulsive disorder. For Axis 2, none. Axis 3, there's nothing there, none. Axis 4, it's affecting making work difficulties. In Axis V, JF, I put down 65. So for theoretical perspectives, for a biological perspective, Antonia's symptoms are a result of genetic, brain structure, and neurotransmitters, which play an important role in developing OCD. She has an elevated cortical cerebral blood flow activation and metabolism seen in the prefrontal regions of the cerebral cortex. It results in increased level of neurotransmitters. For a behavioral perspective, her anxiety included with OCD is contained by repetitive, ritualistic, and compulsive behaviors. And for a cognitive perspective, Antonia has dysfunctional cognition, which result in distortion perceptions and or irrational beliefs. These are threats, confusions, responsibility, uncertainty. Overestimated can be seen when the individual exaggerates the severity of the outcome. Though action fusion is the idea that a belief will increase the likelihood of something happening. So the overimportance and thoughts result when a thought must have a personal significance. Intolerance of uncertainty involves the thought of questioning an act or not being sure that you did something. Perfectionism includes the thought that everything has to go exactly the way you imagine it. So that's kind of all I have. Thank you for listening.